Good morning, everyone. Welcome to this week's Instagram Live. And today we're going to be talking about hormones and testing as voted by majority of you. Today I'm going to be covering why we test hormones, when we test hormones, and how we test hormones. Okay, so first of all, before we do that, I wanted to just remind us what is a hormone. So a hormone is a chemical messenger that allows communication between the different parts of the body. So it controls almost everything from puberty to falling in love, falling out of love, feeling sexy, not sexy, fertility, pregnancy, feeling youthful, energetic, calm, motivated, everything. So hormones control everything. Okay, so why do we test hormones? Now, I wrote on quite a lot of notes because you guys asked some really great questions, and I just want to make sure I cover as much as possible. Now, in conventional medicine, doctors would only test hormones if they suspect there is a problem with too high levels or too low levels, enough to actually cause a physical problem or a biochemical changes that will result in a disease that require medical attention. For example, if they suspect whether you have diabetes, that you might need insulin injection, or you might have a problem with thyroid and you may need surgery or radiotherapy. So in conventional medicine, that's what they would normally do. And the study or the branch of medicine that studies hormones is basically endocrinology. So when you do have a hormone problem, either too high or too low, that will result in a physical or biochemical change and possible disease, then you will most probably be referred to an endocrinologist. So that's kind of like in a traditional sense. However, if you suspect that you have a hormone issue, then I always advise patients to go see their healthcare practitioner first, just to rule out the diseases, just to make sure you don't need the medical attention when you do. However, we know that majority of people walk around the earth, really, majority walk around with hormonal imbalances, and because we are so used to feeling basically, with modern environment, modern chemicals, modern lifestyle, with modern stress, there's so much overwhelm, and so a lot of us have imbalanced hormones or suboptimal hormones. So what is the range? Really, like you say, too low and too high. The one in the middle, traditional medicine or endocrinology don't actually look at. So with those, that's where we see, whether an integrative nutritionist, a functional practitioner, or integrative medical doctor like myself. Just want to make sure you guys can hear me okay. You can just give me a thumbs up if you guys hear me okay. So I'm just making sure. All right. So however, a lot of women I see, they get frustrated because number one, it's difficult to get hormone testing with their traditional doctor if they don't fit in the category of a disease. Or when they get their results and they are told that, everything's normal, so it can't be your hormones. So they get very frustrated because they still feel crap. So that's why it's important when the hormones fluctuate throughout the month, because it goes ups and downs depending on where you are in the cycle, where you are season in your life. So everyone is very different in terms of optimal levels, what you need to feel optimal, balance, alert, energetic. So I had a question as well, somebody wanted to know like the optimal levels of the hormones, and it varies depending on your age, depending where you are in your cycle, and also every lab has their own reference range, so it depends on where you are at. Okay, now before we look at investing in hormones, because it can be expensive and majority of times it's not covered by insurance companies if you went privately, we need to decide why are we doing the hormones in the first place. Okay, so I always ask 3 questions when patients come to see me. Number 1, will the hormone test help me confirm or rule out some differential diagnosis? Number 2, whether the hormone test will actually change management plan. And number 3, will it help me monitor the treatment plan? So those 3 questions I want to ask, because, and I do see patients as well going and buying their own hormone testing, and I will talk more about it later on because there was a question as well now whether they can order it online, and you can, and there's a lot of information out there of hormone testing home kits, and some of them are better than others. So the important thing is that why are you doing it? Because it's one thing about getting the information, but what you're going to do with the information as well. Okay, so if you answer yes to those 3 questions, will it help to confirm a irregular differential diagnosis? Will it change management plan? Or will it guide or monitor the treatment plan? Then yes, it makes sense to consider the hormone test. Okay. However, there are some exceptions. Now, I know partly in Europe, if you were to diagnose perimenopause or menopause based on the National Institute Clinical Excellence guidelines or NICE guidelines, what they said is laboratory testing is not necessary if you are a healthy woman above 45 years old but experiencing menopausal symptoms, and this can range between hot flushes, night sweats, aches and pains, brain fog, the typical symptoms, or even anxiety as well. It also can help to diagnose. You don't need laboratory testing, or you don't need hormone testing if you're trying to diagnose perimenopause. If you have vasomotor symptoms, the hot flushes, the night sweats, and then you have irregular cycles as well. Or if you are trying to diagnose menopause in a woman who's not had periods in the last 12 months, or you're trying to diagnose menopause based on symptoms in a woman without uterus. So there are some criteria. If you're unsure, you don't actually need hormone testing to diagnose that. So that's kind of like in the conventional sense. Now, however, if you go and see a functional practitioner, the approach is slightly different. Okay, now I'm going to read this definition to you, what a functional practitioner who practices functional medicine, what do they do? So according to the Institute of Functional Medicine, or IFM, functional medicine is a system biology-based approach that focuses on identifying and addressing the root cause of diseases. Each symptom or differential diagnosis may be one of many contributing to an individual's illness. The functional medicine model is an individualized, patient-centered, science-based approach that empowers patients and practitioners to work together to address the underlying causes of disease and promote optimal wellness. So you can have naturopaths, nutritionists, or integrative medical doctors like myself who basically apply functional medicine to our practice. So when I see patients with hormonal acne or symptoms with perimenopause or menopause, I may consider requesting hormone testing after a consultation to just get a deeper understanding of what's going on in their hormonal village. And then we can then have a better idea which hormones are driving their symptoms. Because hormones is one thing, is another thing about, your gut health, your detoxification, and also, your mitochondrial health. So all that will also affect how you feel, and they will also contribute to the mix of symptoms. So sometimes it's not just hormones, and there's other elements that you need to address as well. So now I've also collaborated with functional practitioners who've done all the testing and who feel that their patients require prescription for hormone replacement therapy just to benefit them or just to take them to the next level and to replace the hormone that they've lost. Or I've worked with functional practitioners to just help patients with a skin routine, so that they work the internal side, and then I help them with the topical side with that. So, and I've also worked with patients who've done their own testing and wanting to find somebody to help interpret their results and also just to give them a better treatment plan, so different parts as well. So we talked about what is a hormone, what are we testing, and why we are testing it, So summary part again, why do we test hormones? Number one, if you suspect you have a hormone disease that is too low or too high. Or if you want to confirm a rule-out diagnosis, whether it helps management plan or whether to guide and monitor the treatment plan. So that's important as well. So take a deep breath. Okay, hope that was all clear and that was useful. So the next part I want to go through is when do we test hormones? Okay, so now, as I mentioned before, for optimal hormone health, we need to talk about the gut health as well as liver function and detoxification, because all that is important to maintain optimal hormone balance, because it's in charge of metabolizing and, detoxing the hormones that's been used. So for the purposes of videos, I'm just going to focus on hormone testing. Now, to make sure we're on the same page, I want to just remind everybody on the terminology or timings that doctors typically use when, or even labs typically use when you are timing your tests with your hormones. So the only hormones that are cycle dependent is estrogen and progesterone. And the rest of the hormones, which is less dependent, and I will explain more about it as well. So first of all, the timing. So day 1 is the first day of your period. That's when you see bright red blood. Day 14 is when you supposedly have the ovulation, or that's when you're told you ovulate. However, not everyone ovulates at day 14, and it's not always the same in every cycle. So when ovulation, you can test a few ways. Number 1, your basal temperature rises. Your cervical mucus get a little bit stickier and stretchier like egg whites. Or you can do an ovulation test strips. Where did I find that? Yeah. So you can get one of these, online or even from the pharmacies. They are ovulation urine dipsticks, and you test when you ovulate. So that is day 14 normally for a 28-day cycle. But if you have irregular periods, or your periods are shorter or longer, then you might want to check when you actually ovulate, because it will help with one of the hormones, which I'll talk about later as well. And you got the day 28. So day 28 is a typical length of days in terms of a typical menstrual cycle. However, some patients are shorter and some longer as well. So if doctors ask you, is your period short, then it's usually less than 28 days. And if it's long, it's more than 28 days. So that's kind of where the timing is. Okay. So I'm going to share with you the overview of when hormones should be tested. And like I said, estrogen and progesterone are the only one that's cycle dependent. Okay. So first up, most important thing is the estrogen hormone. So estrogen hormone is your female hormone. And I like to call it the diva hormone, and it's because it's important to give you boobs, hips, make everything juicy, sexy, firm up your skin, and hydrate your skin as well. So estrogen is released. It is released during the menstrual cycle, especially increases, peaks during ovulation to release the eggs, release the egg from your ovaries. And the benefit of this role is basically to thicken the uterine wall, ready for implantation. Okay, so the best time to check estrogen is actually, there's 2 times to check estrogen depending on what you're actually looking for. So estrogen, you test it on day 3 or between day 2 and day 4. Okay, and this will be a blood test. And this is the best time to check for follicular estrogen levels. Okay, it means estrogen coming from the eggs. You can also test it together with follicular stimulating hormone, which is FSH, and LH, which is called luteinizing hormone. And these hormones are basically give an indication of how the brain is talking to the ovaries, because during that time, your FSH, LH should be slowly rising at that time. If you have very high FSH or LH, it suggests that you might need more messaging from the brain to your ovaries. So that means that the ovaries is not producing as many eggs. So it may suggest you have a problem with or you may have a problem with ovulation, and so you need more messaging from the brain to the egg. So that's why your FSH and LH is a little bit higher. Okay, so in your reproductive years, the predominant hormone form of estrogen is called estradiol, or E2, and that's what is normally tested in your blood. When you transition into menopause, then you get more estrone, or E1, and this is the most circulating form of estrogen. That's what they normally test. So day 3 is what you would test for follicular estrogen, okay? But day 19, and it's what they normally do if you are checking your fertility as well. Day 19 to day 21, or day 5 to day 7 days after ovulation, is when you test to evaluate the relation to progesterone. And this is when you test progesterone as well. So progesterone is the calming, I call it the calming best friend to estrogen, the diva hormone. So you need progesterone to strengthen the uterine wall so that it's ready and stabilized to maintain the fertilized egg, implanted fertilized eggs. So when you have low progesterone, then there is a risk of miscarriages, heavy bleeding. So you need progesterone enough. So progesterone is only released after ovulation, because you in your ovary, when the egg is released, you are left behind what they call a corpus luteum, and this releases the progesterone to stabilize the uterine wall, and until the placenta takes over and the placenta produces a lot of progesterone. Now, progesterone is important because it calms the skin as well. So that's why sometimes I like to ask patients, if they were pregnant, what their skin was like, because if your skin actually improved, if they had acne before but their skin actually improved during the pregnancy, it suggests to me that their skin, or sorry, let me reverse that to explain that better. So I asked the patient if they if they were pregnant, whether their skin improved, because if they are, then it suggests to me that progesterone is crucial for calming their skin. And then once they deliver, if their skin broke out again, then it would suggest to me maybe their progesterone has dropped way down, and then that's why their breakouts have returned. Hope that makes sense. Okay, so day 19, day 22, or 5 to 7 days after ovulation is when you test to evaluate the relation to progesterone. Okay, so, and this will help you decide whether you've got estrogen dominance, and would explain, your mood swings, your weight gain, hormonal acne, or facial flushing, or heavy periods related to excessive hormones or excessive estrogen dominance. Now, I had a really good question about whether you can actually treat estrogen dominance, and you can. And the timing to treat it depends on a few factors. Number one, your environment. Talking about endocrine disruptors, probably will do another post on that. And then about stress, how you respond to it, and how well you're managing it. And also your detoxification system, how well you're actually metabolizing and breaking down the estrogen as well. So there's different. I share some solutions in my Hormonal Bliss to Growing Younger free guide. The link is in my bio, and you can download it, and then you can learn more about estrogen dominance as well. So we talked about estrogen and progesterone. Now, this is the assumption that you have regular periods. Now, what happens if you don't have regular periods, or you're on the birth control pill? Now, when you don't have regular periods, it's a bit difficult to time it. So when patients don't have regular periods, like in perimenopause, that's why a lot of doctors don't want to do blood tests, because the blood test is a snapshot in time, and because of its fluctuation, depends on where you take it. Sometimes it can be high and sometimes it can be low. And that's why in those cases, I tend to use the urine test, which I'll talk about in the latter part of this session, talking about how to test hormones. Now, for women who are on birth control pill, what that does, it suppresses your own hormones, so that you get everything very low. So it doesn't actually give you a good indication or reflection on what your hormones are actually doing, really. So the best time to really check it is if you do stop the birth control pill, and maybe 3 months down the line, once everything is normalized, then you can test your hormones as well. However, if you want to see what your detoxification system is doing, your liver function, how your liver is detoxing the estrogen, let's say for example, then yes, you can do that even if you are on birth control pill. Okay. So the next one is your testosterone. So your testosterone is what I call the masculine hormone. It's important to feel confident, sexy, and strong. So testosterone is highest in the morning. So the best time to take it is actually between 7 to 10 a.m. in the morning. And it's usually taken with a blood draw, and it's less cycle dependent. Now, to get a full picture of testosterone, you need to take total testosterone, but also free testosterone, as well as the sex hormone binding globulin, or SHBG. So total testosterone is comprised of the bounded testosterone, bounded by protein, and unbounded, which is the free testosterone. So the free testosterone, that's the active testosterone. The bounded testosterone, which is bounded by the protein, that is basically like in the way that the stored testosterone, and it's not actually active until it's needed. So Sex hormone binding globulin, that's the protein that is binds to the testosterone. That's important to know as well, because if you suspect, let's say PCOS or other, hormone acne and issues, and why your testosterone may be. So your total testosterone may be normal, but maybe your free testosterone is very high because you have very low binding globulins, so the active testosterone is actually higher in relation to your total testosterone, and that's why you might be getting more symptoms. So low levels would lead to low libido, fatigue, and potentially depression. And high levels is often seen in PCOS, acne, excessive hair on the chin, chest, and abdomen. And high levels can also lead to loss of hair on the scalp. So testosterone, if you have any symptoms, it's worth checking your testosterone. And remember, you want to check your total testosterone, free testosterone, as well as the sex hormone binding globulin as well. The next hormone is your adrenal hormones. So when I work with patients to balance their hormones, I like to look at the health of their adrenals, because your adrenals is what you produce cortisol, your stress hormone. So it gives us an indication of how well you're responding to stress. Not just what's on the outside, but actually what's actually happening inside your body. So if you watch my video on hormones that affect skin and aging, you know that how I see cortisol is basically the hunter, the warrior, and the protector. So cortisol is involved in your stress response, regulating blood pressure, blood sugar, inflammation, digestion, sleep, and how quickly you repair yourself as well. So in times of stress, your body can go into a phenomenon called cortisol still. And what it does, it diverts to the production of progesterone in favor of producing more cortisol, because you need it to respond to stress. However, as I mentioned before, progesterone is your calming best friend. So if you have less progesterone, it might affect your sleep, it might affect your skin, and it might affect your, and you might get estrogen dominance because you have relatively low progesterone and relatively high estrogen as well. So cortisol blood test is best taken in the morning. And if you are taking, usually if you were to do other cortisol blood tests, you also will do a DHEA. So the DHEA, you can take it any time of the month, even cortisol as well. And it's a crucial anti-aging hormone. It's a precursor to estrogen as well as testosterone as well. So it's an important marker for adrenal function. So normally they would do a DHEA sulfate or DHEAS, cortisol. And if the doctors suspect that you might have a cortisol problem, then they will also check at ACTH as well. But that is not typical test if you don't see a doctor for that. So, but for a more comprehensive picture of adrenal health, I like to use the salivary test or the urine testing, which shows us how much cortisol reserves that we have, and whether it's converting well enough as well. So I'll talk about that next. Then next we have the insulin. So insulin is tested if you're trying to get to the bottom of PCOS, or if you have family history of diabetes, or if your clinician suspect that you have insulin dysregulation, so you're not actually regulating your sugars properly. So insulin is a gatekeeper to how much your cells take in glucose, and how it's being used as energy and how it's stored as well. So insulin is tested while fasting, and usually tested alongside with glucose, and so because of that, it's done besting in the morning. And other helpful tests when you're testing insulin is the glucose tolerance test. This shows you how well your insulin responds to reducing blood sugars. What they do is they take a blood test before you drink a sugary drink, and then 2 hours afterwards, and just see your blood sugar levels then. And also, more importantly, you want to do a test called HbA1c, and this looks at how well your sugar is regulated in the last 3 months. Because it's very high, it suggests that there's more glycation, which is basically like sugar crystals in your cells. So HbA1c is a really good indication of long-term regulation of sugar. The next hormone is thyroid hormones. So this is best tested in the morning as well. The test usually, when you do it in conventional in the doctor's office conventionally, they will only test TSH, the thyroid stimulating hormone, and also T4. But usually that's not enough because you do need to know the free T3 levels as well. So free T3, that's what is the active thyroid hormone and what affects your energy, your moods, and your weight as well. So what I recommend patients to do, your TSH, thyroid stimulating hormones, how your brain talks to your thyroid, your T4, which is like the stored inactive thyroid, and then your free T3, which is what converts from T4 to T3. So this, and you can do total as well as free, but most important is the free T4 and T3 as well. Now, if you are going to do a thyroid test, check the supplements that you're taking. If you're taking anything with biotin in it, you need to stop it at least 72 hours before your thyroid test, because it might affect the results. Okay. So we went through estrogen, progesterone, testosterone, insulin, thyroid. So 5 very important hormones. Now, the next 2 I will mention is not necessary, but it's helpful. The first one is melatonin. So melatonin is a hormone that controls your sleep-wake circadian rhythm, and is best known in its role for maintaining sleep. Okay, so it starts to rise in the onset of darkness. It peaks in nighttime between 2 to 4 a.m. and then slowly depletes, in the second half of the night. Now, melatonin is really affected if you're a shift worker or you work late, or you have jet lag. So again, it's not necessary, but if you are suffering from restlessness, insomnia, difficulty waking in the morning, or poor stress response, then I do recommend it. And usually you can test it when you do a cortisol saliva or urine test as well. Okay, so that's a melatonin. So, and the second extra hormone is actually vitamin D. Now, I know a lot of people may think, oh, that is a vitamin, but it's actually a hormone. It's an intracellular hormone, as they call it, and we need it it's a precursor for so many hormonal functions, if you like. So vitamin D is so important for controlling inflammation, supporting bone health, immunity, blood sugar, blood pressure. So vitamin D is very important. So, and this is a blood test as well. You can do a pinprick at home, and you need to check your levels. I'm not going to talk about levels because I actually mention it on my free guide as well. Is it on there? No, it's actually in my sleeping. That's right. I created a course called the Sleep Better, Grow Younger course, and I talk about tested extra testing support if you need to improve your sleep as well. And this is at the moment is only available as a bonus when women join my Grow Younger club. So if you're interested in that, do have a look at that. So we've done the 7 hormones. So we got the estrogen, progesterone, testosterone, insulin, thyroid, melatonin, and vitamin D. So hope that was useful in terms of when we are testing the hormones, what is cycle dependent and what is not cycle dependent, and what hormones we are testing. Okay, just a summary first before we go on to how we test the hormones. We talk about why we test hormones, and then we talked about when to test hormones. So the last part is really, and then I'll open up to questions afterwards. I have some questions as well sent in by my audience, but if you guys got any questions, do let me know. So the last one, we'll talk about how we test hormones. So you can test hormones by serum, blood, urine, and saliva. So those are 3 main ways. So each of them have their own advantages and disadvantages, but in general, the blood test reflects total levels. You can't tell whether it's bounded or unbounded, unless it's specifically said, like testosterone and free testosterone and total testosterone. So it mainly reflects the total levels. The only problem with blood test is only a snapshot in time. So as I was saying, in perimenopause, when your hormones fluctuate, or even in your normal menstrual cycle, if you don't do it if you don't do your blood test in the specific time for even a regular menstrual cycle, you might not get the right levels that you're looking for, or it might be too low, it might be too high, just because it fluctuates as well. So it just shows a snapshot in time. So it depends on what you are specifically looking for. Again, so however, the blood test is the range, the range is widely acceptable throughout the labs all around the world, and there's more data in terms of it being acceptable. Okay, now with the urine and saliva, it can be controversial because a lot more naturopaths, functional practitioners use it. I personally like it. There are studies that show its validity. Again, it's important to know why you're doing it, and also find somebody who can interpret it and then use the information to help you, improve or fine tune your lifestyle, or fine tune your management protocol. Because I have met patients, or seen practitioners who've ordered like £2,000 worth of investigations, and that's a lot. I mean, if you can afford it, great. You want to know everything about yourself. I definitely, I would do it if I could do everything. But a lot of people, majority of people, can't afford that much in terms of testing. So I do have a few tests that I deem more important, and sometimes I would maybe do it later down the line when I'm seeing a patient, because it might not change my management plan. So the three things I was saying about, why we do testing. Number one is to confirm or rule out a differential diagnosis. Would there be a potential medical problem, and then I need to refer to a medical specialist for the patient to gain medical attention. Okay. Then number two is whether it would change my management plan, and number three, whether it would guide or fine tune, my protocol. So those are the three reasons why I would do a test. So with the urine testing, I like, especially for hormones, because it gives a very comprehensive range of hormones, and its metabolites as well. So its main thing is mainly to check how the body is using it and how the body is breaking it down. So I often combine the two in terms of blood and urine, but if I had to choose, I would choose the urine. Okay, because again, I want to see how the body is breaking it down, especially if somebody who has estrogen dominance. I want to see, what the liver function is doing, the detoxification phase 1, phase 2. I go in depth with it in my free guide, the Hormonal Bliss to growing younger. If you want, there's a link in my bio. You can download it. So, and also the urine is, you collect it in a strip. I use the Dutch test. I know a lot of people do. It's probably one of the best urine testing out there in the market. And you would test 4 to 5 different times in a day. So it gives like an average. So even if you have fluctuation, it just gives an average of, your hormones levels as well. Now, the Dutch do a very good one called cycle mapping. So if you have irregular periods, that's really good, because you do 9 tests in a space of 28 days, and then it just gives you an idea of what your hormones are doing. So that's called the Dutch cycle mapping as well. Okay, and it's easy to do. I've done it. One day I'll show you my results. I've done it, and so you can do it at home. And then the third type of hormone test is the saliva test. I don't particularly use it unless if it's with my Dutch Plus test. So Dutch Plus is, you do the urine, but also the saliva, because it looks at cortisol, what they call cortisol awakening response, or CAR they call it, and it's basically looking at how well your body is responding to stress, in terms of, is it releasing cortisol in the right way, and is it going down in the right way so that you're able to sleep. If you're finding that you are feeling very burnt out, or you're not getting enough sleep, or you're difficult waking up in the nighttime, then you may want to consider doing a cortisol awakening response, because it would basically tell us what your adrenal cortisol reserves are. And also like the car, how much fuel you have in your battery, how good your pedal is working, and how good your brake is working as well. So that's why I like the cortisol awakening response. And that one you can do with the saliva test as well. So with the saliva, it's great to evaluate the daily changes in cortisol and melatonin. So that's what I would use saliva for. I don't really like using it for the other hormones like estrogen, progesterone, just because, especially if you take topical preparations, it does affect the results, giving a very false high level. So I don't particularly like using that. Okay, so a list of hormones you can check with bloods. And again, this you can do it from your drawing blood from your arm at your doctor's office, or a pinprick in your finger and from at home. So you can check follicular stimulating hormone, FSH, luteinizing hormone, LH, thyroid testing, cortisol, DHEAS, estrogen, progesterone. Again, those are cycle dependent, testosterone, and insulin. So those are the vitamin D as well. So those are, I would say, the top hormones that you want to do for blood if you're concerned if you're hormone imbalance. So again, I said, I love Dutch testing. You can go to dutchtest.com. I'm in UK, so I get my Dutch test from regeneraslab.com. So Dutch, what it stands for is Dried Urine Test for Comprehensive Hormones, and it's from Precision Analytical. So it gives a beautiful list of hormones and metabolites. I like looking at the graphs, to be honest, and it's really, to me, it's a great picture to see what your hormones are doing in terms of how it's being used, and we will be able to see whether you're going down the healthy estrogen metabolism or the not so healthy estrogen metabolism, and what we can do about it. So that's why I like the Dutch test as well. So again, I mentioned it's important to have a licensed practitioner who know how to read the test, so that you're not just going to waste your money and don't know what the results are for. Okay, so somebody asked me where I can get the tests from. Again, I use Regenerous Lab. You go to Regenerous Lab and then have a look at the test, and they give you information what they're looking for as well, and then it does allow you to purchase it. And then they can send it to you for that as well. And then I know in USA you got your lab work. Yeah, your lab work. So they also have hormone test as well. So good brands I like Genova DX, Genova Diagnostics, Dutch Test, and ZRT. So those are the three I like. I know there are lots of others, but those are the three that I'm more comfortable working with and I've worked with before. So again, I said it's not about the test, because a test is one thing. From medical school, we've always been taught, don't treat the test results, treat the person. Okay, so when we see a patient, when we see somebody, number one is a consultation to find out whether testing would actually change anything. So we're treating the person, and the test is just to help us confirm or rule out things that's in our differential diagnosis and help us fine-tune the treatment protocol. Okay, so that is kind of the I would say things that to consider when you're looking at hormone testing. So I hope that was useful. I know we covered quite a lot of things. I'm gonna go through some questions, and if you guys have any questions, please send it to me as well, or just put it down at the bottom as well. Now, someone asked, exact tests to ask for and what the optimal levels are. So I did mention about the different types of tests. The optimal levels are different, again, depending on the labs used and also where you are in your cycle. And also everyone is very different in terms of what is their optimal level to feel great, feel energetic, feel calm, feel I can do this, basically, and feel youthful. So as long as you're not very low, very high, a lot of patients, a lot of people actually are suboptimal. So it's important to know what works for you. Okay, what time of the month to test if you're perimenopause or periods are irregular. So perimenopause, if you are following the NICE guidelines, If you have perimenopause, if you're over 45 years old, if your periods are irregular, you don't actually need blood tests if you, according to NICE guidelines, to diagnose that you have perimenopause. However, if you go to a functional practitioner, naturopath, nutritionist who practice functional medicine, they may consider doing a hormone test to see whether there are other factors that's causing your symptoms as well. Maybe a gut health issue, or hormone testing, but specific hormone testing as well. Like thyroid, which you don't need to be cycle dependent, melatonin, cortisol, so those things are not cycle dependent. Okay, so again, periods are irregular, you can do the cycle mapping Dutch test. It looks at 9 spots throughout the month or throughout a 28-day cycle, just give you some idea how your hormones are fluctuating as well. But you are right, you don't need the hormone test to diagnose it. And sometimes patients actually start on treatment. So for example, hormone replacement therapy, I'm just giving one example of a treatment. Okay, after doing the lifestyle changes, other alternatives, and discussing all the alternatives, and then after we look at the risk profile, then if we do start somebody on hormone replacement therapy, we can do a blood test to monitor the levels. It's not a must, but it's helpful. Okay, so that's to answer that question. How can estrogen dominance be treated? Yes, it can be treated. Again, time of treatment depend on different factors. Your environment, what your toxic burden is, they like to call it. So how toxic your environment is. So whether you have endocrine disruptors, what you put on your skin, what you breathe, what you eat. So those are important in terms of whether you are detoxing it well. Okay, your stress levels, how much you have, but also how well you're responding and managing it, and how well you're reducing it, so it's not in how you're reducing inflammation, and also your detoxification system. So working with a functional practitioner can help to reduce estrogen dominance. Definitely exercise. If you are wanting to do DIY, I share some solutions in my free guide, the Hormonal Bliss to Growing Younger, on link in my bio. But essentially, food is important in terms of how to have an anti-inflammatory food. Movement and exercise, reducing visceral inflammatory fat, that's important. And also managing stress. Those are the 3 foundational parts of estrogen dominance. And then somebody asked a more specific question on HRT. It's not really relevant to the hormone testing, but I'll answer anyway. So she said, I have estrogen receptor positive cancer, secondaries, and currently on tamoxifen. Tamoxifen is basically an anti-estrogen medication that patients go on for breast cancer. Okay, so it basically blocks the estrogen onto the breast. Can I still have hormones? It's not routinely recommended. However, it can be considered after careful assessment and weighing the risks and benefits. So I always, when patients with cancer or history of cancer, when it comes to hormone replacement therapy, I always say speak to a menopause specialist who specifically works with women with history of cancers or does have cancer as well. So that's kind of round up in terms of my topic today. Do you guys have any questions for me for hormone testing? The why, the when, and the how. Okay, so I'm just gonna start. So just want to say thank you to some people who have joined us. So Mikey, Sharon, Julie, Charlie, Bethany, Rashina, Robert. So thank you everyone for joining me. So if there's no questions, I will be saving this up on IGTV, and any questions, of course, you can send it down and put underneath the video, so I can always answer back to you when I can. So thank you very much for joining me this morning, and hopefully you found it useful. And if there's any questions, let me know. I'll see you guys next week.